Okay, so the speech that I'm refuting is limiting access to abortion will threaten the physical and psychological health of women. My opponent's secondary claims was the harm that done to the physical health of women by limiting abortion, and her second secondary claim was the harm it does to the psychological health of women. My response to her first secondary claim is that abortion does damage to the physical health of a woman. Some problems she had with her evidence was that she used two special cases in both her secondary claims. She used a cancer patient and she used a rape victim. Now these are two special cases, but she did not include those in her first claim. This is a big problem because she's making a claim on all women, and out of all women, how many women are rape victims and how many women have health issues? Not a lot, so she's got a big problem right there with her evidence. So I'm just going to go over some stuff that abortion does to, some physical damage it does to women. Abortion increases pregnancy-related maternal deaths. An example of this is in ectopic pregnancies. Ectopic pregnancies occur when a gestation takes place outside the uterus, commonly in the fallopian tube. Such pregnancies are responsible for 12% of all pregnancy-related maternal deaths. Studies show that the risk of an ectopic pregnancy is twice as high for women who have had one abortion and up to 4 times as high for women with 2 or more previous abortions. Those who have an ectopic pregnancy, 40% become infertile, and the odds of having another ectopic pregnancy are 1 in 3. Another thing that abortion does to women is that abortion increases the risk of getting cancer. Women with one abortion double the risk of cervical cancer compared to non-aborted women, while women with 2 or more abortions multiply the risk nearly 5 times. Similar elevated risk of ovarian and liver cancer has also been linked to single and multiple abortions. After extensive research by Dr. Joel Brennan, professor of endocrinology at City University of New York, he concluded that the single most avoidable risk factor for breast cancer is induced abortion. A woman who has an abortion increases her risk of breast cancer by a minimum of 50% and as much as 300%. Some other risks of abortion is bleeding. Some bleeding after abortion is normal. However, if the cervix is torn or the uterus is punctured, there's a risk of severe bleeding known as hemorrhaging. When this happens, a blood transfusion may be required. There's also other risks like infection and damage to the organs, and in some extreme cases, death. Now, my response to her secondary claim was that abortion harms the psychological health of a woman. Her claim was that limiting abortion will harm the psychological health of a woman. My response to that is that abortion harms the psychological health of a woman. Like I stated before, some of her evidence was based off a special case, which was a rape victim. And like I stated before, that's a problem because not all women are rape victims. My counterclaim to that is that it does harm to the psychological health of women. Women who have abortions usually go through a post-abortion syndrome, PSA. An Elliott Institute study indicates that women who abort 5 times are more likely to abuse drugs, and post-abortion syndrome makes people who are having PSA experience drug and alcohol abuse, personal relationship disorders, sexual dysfunction, repeated abortions, communication difficulties, and so on and so on. As you can see, my opponent had a good claim and she had good evidence. She had a good claim going on, but in her evidence she used 2 special cases, and that's just messed up her claim because in her claim she included all women, yet in her evidence she had 2 special cases, which was a big problem. She could have had a good argument if she included the special cases in her claim, but she didn't. Thank you.
Well, that ended up being much clearer than we had that whole conversation with the other night. I thought you did a good job identifying what the advocate's main claim was and trying to put your argument into context. I think that you're missing an opportunity here on language issues to make the argument, because the advocate is in essence saying that there are two big threats on the first point. The danger to a woman's health and the danger of cancer patients because of the example that she's using. The primary danger to a woman's health in pregnancy is ectopic pregnancies, and what you want to say is, you know what, ectopic pregnancies are in fact dangerous, but the thing that causes most ectopic pregnancies is having a previous abortion. So it's not a lack of access to abortion that causes this risk. It is in fact access to abortion that causes this risk, and then you turn their whole argument kind of upside down on that particular point. I thought you did a little bit better job of that on the second part with the cancer argument, where you're in essence saying, you know, the example of a cancer patient being somebody who's at health risk and needs to have access to abortion, the truth of the matter is having access to abortion is one of the things that contributes to the risk of cancer. So in essence, I think you've got an opportunity here to kind of turn the language around and use it to make your point more effectively. And you're making the point. I just think it's something where if you had the claim a little bit clearer, it would be so much easier for the audience to remember the point that you're making there. I thought that you did a good job on the second part, talking about all of the unusual nature of the argument that is being presented and presenting a counterclaim on post-abortion stress and the issues that might be going on there. You've got good counter evidence on that particular point. The explanation about the problem with the examples that the advocate is using are okay, but don't be shy about making the argument that in essence this is a hasty generalization based on atypical cases. The one thing that I think would have strengthened that would be, for instance, to show, because the rape issue comes up in both points, is to show the infrequency with which women are pregnant as a result of rape, and that is in fact, you know, that would help show that it is in fact an unusual circumstance. You kind of just take that as a given. All right. Thank you.